All right, good morning. The good news is we have eliminated the Secretary Treasurer report for some reason, so you won't have to hear me talk about hotel deposits or AV costs. But please pay your dues, because if you don't, the first thing they cut is the cocktail hour, and this meeting is no fun without the cocktail hour. I can promise you that. So yesterday we talked about the science behind the fundamentals of vascular surgery, and today we're going to dive right into how you actually get it going in your program. So again, this is what we're trying to fix. We're trying to shift the learning curve on fundamental vascular skills in trainees from really attaining it in their fourth year of integrated and the second year of fellowship, and push that into their earlier years so they arrive to the OR better able to learn. So what are you going to get? So every program in the country will get a fundamentals of vascular surgery kit, and the kit will contain a few things. The first is the videos. The videos will describe each skill in detail. So what I ask of you is that when you show the videos frequently to the trainees, so that they do the tasks as instructed. And everybody has a different way to do an enticide and anastomosis, and I'm well aware of that. But try, for the purpose of the exercise, to stick to how we do it in these videos. That's one thing I learned going to Europe to their sim courses, is even though all the individual surgeons have different ways of doing things, they decide on a kind of a uniform way to teach, and that leads to a lot less confusion among the trainees. So do try to let them do it as we instruct them in the videos. There'll be a video for each skill and files, and then of course instructions on how to use them. Also, you get the tubes. So the tubes are for the clock face model. They look like this. We'll probably be starting, I think, with about 2 per program. If you need more, these are fairly cheap to make. So we should be able to, depending on how often you're going to use them and how many trainees you have, we probably can get you some more. But we'll start off with probably just 1 to 2 per program. You also get the graft materials. So Gore is going to send you a lot of 10mm grafts, 8mm grafts, and also the sheet material for the clock face. At this point, we plan to also send you stamps, so you can stamp the patterns on the PTFE material, so you can kind of convert extra. So we'll have stamps for the clock face model and a stamp for the patch. The enticide doesn't need a stamp. You also get a stand. Those are just kind of the weighted stands that they can clip the PTFE tubes into so they can suture. Gore makes those, and we'll probably be sending a couple out per program. You'll be able to interact with your local Gore up as well to get more materials as you use them up. You're going to get our rating system. So there's a global rating score sheet and then a global summary. We're going to give you both of those, and kind of with some best practices and instructions on how to use that as well. So what do you need? You need a secure location. So if your sim center is 5 miles away, don't use it. Find a place that the residents can easily access in their spare time so they can practice. What you have to set up is kind of an area for them to practice. And depending upon how much material you get or how you want to do it, if you're just going to do it in your junior residence, they can even take the materials home. So you have to figure out with your trainees where they're going to be doing it. And they should be able to have, like I said, ready access that they can do it at least weekly. You're going to need suture. So we recommend 50C1 and 30S8. So get friendly with your Ethicon rep. Gore will provide suture. The white suture, however, is a bit hard to judge the final materials on because it kind of blends in with the PTFE. So we do recommend Proline, but either is acceptable for practice. And then you do need to supply your own surgical instruments. So when I first did this and we set it up to the kit. So every kit basically has 2 sets of forceps, Metzenbaum scissors, 11 blade, a Castro, a Rider, and some hemostats so they can kind of weigh down their suture. The original equipment I bought so we could do 12 stations at once cost $35,000. My friend Mark Matos was visiting. He picked up his phone and showed me that you can get the same stuff on eBay for like $6. So don't be like me. Just go on eBay if you don't have, all this stuff is fairly readily available in pretty good condition. So it should not cost you a lot of money to get a couple of suture trays together. $6. What you need is faculty. Simulation takes energy. And so I really suggest you don't take on this project entirely by yourself, especially if you're older like me. Find a younger more energetic champion to do this. There will be down the road opportunities for research and presentation. So find a young champion on your faculty who's really going to keep this organized and together, and we will work with them. It's a lot to do this. So when the practicing, doesn't take a lot. You just have to get in the supplies. But when you run a testing session, which we suggest you do about twice a year, it takes a bunch of faculty. So make sure you have some time set aside because we have to, you have to kind of watch the trainees do it to grade them fairly. There is an endo model. So right now, if you have a symbiotic system, we will work with you on getting the modules. They just plug right into the symbiotic system without much fuss. If you do not have a symbiotic system, don't worry right now. We're going to integrate the endo later. We really just want you to concentrate on getting the open models up and running in your program. So we did the pilot program, which showed us that there were a lot of legal hurdles to getting this stuff out to you, but I think we're kind of past that now, and those 10 institutions should be getting their materials shortly if they've not gotten it already. And then the rest of you, I hope to have all of this in your hands over the next academic year so we can do a national rollout in 2021 to 2022. As I said yesterday, this is endorsed by both the VSB and the APDVS and will become a requirement for trainees, but we're not trying to force this down anyone's throats. So we're still dealing with getting you the materials and kind of proving the efficacy and the feasibility at this point. So we just want to take the next academic year to make sure we get all the tools to you that you need, answer all your questions, and support you in this any way we can. So year one, we would like you to run the full exam 2 to 3 times per year. So every 6 months or every 4 months. The exam complete to do only takes about 2.5 hours to put your trainees through it. So it's not going to take up a full day. So if you set aside, a couple of retreat days, that should cover it. The best practices, we strongly encourage you to reach out to your leadership and get them involved. Like I said, there's opportunities for research here. But it's going to be an effort overall for your program, and we want to make sure your leadership supports you in this endeavor and gets involved. This is from Dr. Jason Lee. He says, get the general surgery residents involved. It is fun when you get like a large bunch of people together. When we do the fundamentals course and we get 40 people in a room doing it, it is collegial, and the trainees really enjoy it. So the more people you can get involved, especially when you do your testing sessions, I think the better everyone will enjoy it. That's it for now. We just want to make sure that all your answers all your questions get answered, and that we kind of make this process as easy as possible. Yes, Keith, 5-2 as well. And it's mandatory, Keith. You'll be happy with that.
Thank you. Thank you, Mal. And so, as just described, this has been a work in progress for more than a decade. It's validated. It's effective. It clearly differentiates the novice from the competent surgeon in these basic skills, and there really are basic skills. We're not expecting that this replicates doing an open operation independently, but it will certainly differentiate those people who need to work on their technical skills more, and so there's some questions ordering the kits, and so I think Dr. Sheahan, maybe you want to respond to that.
Yeah, we know where you live. We've got your list. We can find you, and we're going to get them to you. So we already have a plan to get them into every single program. It's a lot of this is kind of boots on the ground. So we deal, especially with the PTFE stuff, for your local GOR reps. There is no, so we're going to work with, sorry, I'm seeing a bunch of questions, trying to answer all in my head. So for Dr. Harris, we're going to get them to you, so you don't have to worry about that. We do not have a plan to make Amentis. Symbionics own some of the intellectual property. They helped us develop it. Mentis has, I noticed, a similar module. If you have them, I'm not asking you to buy a Symbionics if you don't have one. The plan probably will be to get your trainees access to it at the BAM, at SCVS, at the regional meetings. We'll make sure that, you have ample opportunity to practice on the Endo simulator as well. Testing data. Sorry, Dr. Matros, I didn't quite.
Assumption of
Oh.
kits only to those that they use is correct. Yes. You will get a kit, but we're working with Gore and some of our other industry partners to get that together. And so you'll get your kits, and we will hopefully be able to start in July or so early in the summer to get the process rolled out.
And to those who reached out to me yesterday, I am aware that I look tired, but I ask any of you to serve as Secretary Treasurer to Jason and Murray for a year and see how you look at the end of it.
Yeah. There's no comments about why he's tired.